morning. So today we have got Delren with us, and Delren is the president of Association of Residential Aged Care Operators in Malaysia, in short, AGECOPE. So perhaps, Delren, if you can just share a little bit with us about what AGECOPE does.
We were formed in the year 2018. We were initially started in the year 2016. We decided that we should have an association to protect all the care operators within Malaysia, because there was no body, no official body to take care of all the needs and problems faced by individual care operators. Everybody was on their own. Everybody was defending by themselves. Whatever the government said was law. So there was a need to set up this association, and with the help of my aging unit of University Putra Malaysia, we embarked on this journey to start off this association. Then the journey started in the year 2018. We got our association registered, and our first meeting with the government to inform them was with YB Hanayu. Then she acknowledged our existence, and from there onwards, we informed JKM that we are going to embark on registering unlicensed and licensed operators to become under our wing, and anything they want to set up, at least notify us so that we can give our feedback. The good point of starting this association is that after knowing of our existence, the government invited, and we can give our input during the meetings for Rancangan Malaysia ke-12 on the aging sector. And we raised up a lot of issues, especially after in the year 2017, under the Barisan National Government, they enacted a law which was passed in 2018, whereby the current licensing of care operators under Welfare Ministry will be handed to the Health Ministry, and will be under a new Act 802, whereby it will be more stringent, and all homes will be classified as nursing homes, but it will be under the Health Ministry. Of course, when you do this, a lot of care operators cannot come out with the funds to upgrade their home to be as comparable to the requirements of a nursing care home as compared to a welfare care home. So this is where AGECOPE comes in. We try to mitigate, lower down the standard a bit of the Health Ministries Act, but upgrade the standard of the Welfare Ministries Act, so we can come to a middle ground whereby can assist all care operators. That's what our task has been doing. And our main issues we face in the last 2 years since registering has been unlicensed homes. Members who cannot get license for their operation. Normally, it's not that they do not want to be licensed, but because they have faced issues with the local authorities. To get a license, you need to go to the Welfare Ministry first, number one. After the Welfare Ministry, you get the you go to SSM to register your company, and after SSM, you will go to the Town Council to get it endorsed or approved according to the perancangan unit. And after that, you go to the Kesihatan and Bomba to get approval. Finally, go back to the Welfare Ministry. But most operators are stuck at the local council, because different towns, different states, different districts have different law in regards to operating a care center in the area. Yeah, so this is, I boil down to, because every town council, their members, the exco, the councillors are made up from political connections. They look at scenarios according to their towns. They look at scenarios according to the needs of the people in the town, and they sometimes when they do or pass new regulations, they overlook the federal government requirement or regulations. So that is, federal government say that we need more care homes, but town council put a lot of hindrance to getting more care homes. There's
mm.
no continuity between the federal government and the town council.
Sure.
And when you have different political connections involved in the town councillors, you get 20 new town councillors coming in every 2 years in a town. And if each of them have different idea, different rules to set, imagine when you have more than 400 town councils or this, and that's where the law has changed so much that in PJ, example, in PJ, you cannot have one center that is near to another center within 100 meters from another center. You can't have one.
Okay, but there's already so many, especially in, I think, Jalan Gasing, that side, right?
Yes, possible. They are not licensed. Possible.
Oh.
That's why you have so many. Okay, and the law set for PJ back then was that you cannot have more than 50 care homes in the entire district of PJ. But this law was set back in the 1970s.
Oh.
But now you may need it about 100 or 200 care centers. So when you're using old archaic law in new regulations and you impose new things, it makes it difficult to get licensing. Take example, certain states, I won't mention the area, otherwise the PBT will go and impose new rules. You don't need neighbors' permission to start a care center. You don't need. That means if you get the welfare department approval, you get the town council approval, that's it. You can start operating. But in Kuala Lumpur or in PJ, you need to get the immediate neighbor's approval. The moment one neighbor said no,
you cannot.
So you may go to the welfare ministry. Now the rule is you go welfare ministry first. Welfare ministry said yes, you can get it licensed there, that area. Then you go to town council asks the neighbors, say cannot. Then you're back to square one.
Oh dear. Okay. So there's a lot of onus on the operator themselves to, how to say, weave through all these policies.
Yes, yes. So if the welfare ministry is aware, they should say that for states that or areas that require neighbors' permission, you should go to the town council first. Get the approval of, then only come to us.
Yeah.
Okay. In Penang case, there is another dilemma. The neighbors may say yes, but what you get is zoning. The town council said, yeah, the neighbors say yes, but this is not under our zoning area.
Oh, wow.
So when in Penang, you said, no, this zone is not zoned for residential care within that area. You have to go and open in another area that is zoning allows. So when you do that, sometimes the place is not convenient. You're going to ask for someone, oh, I plan to start here. The owner allows us to open here. The neighbors are okay with it. But now you're telling me that this is not a zoning area for care operator. You ask to open another area because you zone the area. But the area, the neighbors may not allow.
Yeah, so that's just the setup. So my question is also, is there any policy to govern the the staff or the people who are serving the residents in the homes?
No.
Okay, because most of the time, I mean, the ones that I see is often understaffed. So
Yeah.
I guess it's also a question of, who then will govern the quality of living in these homes?
Now, the guidelines is not there to say who is to serve or work in the care home under the licensing department. Now, when you apply for a license, they need a staff who is at least a nurse. One, it can be the care operator, or it can be like a non-nurse, but one of your staff is a nurse. Okay. So at least one. But there is no law governing that the nurse won't resign. Subsequently, there's no say you must be there all the time. And though it stipulates that one staff for every 8 patient or 8 residents, but it didn't say what type of staff.
I see.
It didn't classify that the staff must be trained. It just said a staff.
Then how then, in this, whether if it's government or people who are able to influence the quality of living, right? What do you think we can do to help in terms of providing them?
So when AGECOPE came into the picture, on top of licensing issues, we also look into the long-term caregiving,
Mm.
how to upgrade the care in all the centers, and how to ensure that all the centers have enough staffing, where we are trying to find out what is the problem faced by everyone. Is it salary-wise? When it comes to salary-wise, some are paying very good, but yet people are still leaving. They don't want to work there long-term. We had a problem with staffing. There was an acute shortage in the initial part of the MCO, whereby nurses waiting for placements normally take 6 months to a year to be placed in a hospital. While awaiting placements, normally they'll work in the care home, nursing home for part-time. But during the first month of MCO, the government absorbed all the nurses at one go. So when all the nurses left, despite some operators were willing to give better pay than the hospital, yet they left. So there was an acute shortage. So now how to fill this gap was that we are looking into meeting up with the Human Resource Ministry to open up this sector, caregiving sector, to foreign workers if locals do not want to work in this area.
But even with this pandemic, also we don't. I mean, the borders have not opened, so
Yes,
foreigners are not. So we're
are
still
not allowed. Yeah.
yeah.
So we have to wait.
Yeah.
So when you mention about caregivers not being properly trained, one of the reasons is that when you have staff shortage, so whatever staff you get, you accept first. So we have no choice but to employ them first.
But since we mentioned about MCO, so I've also read an article recently at Malaysia Kini about how nursing homes somehow have contracted like high number of COVID cases.
How to prevent? Yes.
Yeah, so I think the first question is more of how did that even happen? Because I think during MCO, visitors are not supposed to come in at all. So how did the residents then contracted this cases?
Now, the government SOP of disallowing visitors was sent out to all the licensed homes.
Okay.
Majority of the homes you see contracting or being infected by COVID-19 are those unlicensed homes. The message didn't get to the unlicensed homes.
Oh dear. Okay.
Okay. In our country, there are about estimated 1,700 to 1,800 care homes in the country, whereby only 361 are licensed. Very clear? Yeah.
Yes.
That leaves about another 1,400 unlicensed care operators throughout the country. Like I said again, not many that don't want to be licensed.
Yeah.
Many want to be licensed, but they are facing hindrance. So messages that are supposed to go to all these people are not being received.
It only reached to the 300 plus.
300 plus, or to unlicensed home who are AGECOPE members. So we do pass this message to our members that no visitors. Now, on top of that, there was one of our member who infected by COVID-19, and we found out subsequently is due to the staff who were in and out of the residence. Now, majority of the centers locked down their staff within the center during the MCO, but not all centers can afford to do that because many of these staff have families of their own. They have children of their own. When the children don't go to school, someone to take care of them at home.
Yeah.
So they need to go back home. So when they go back home, in and out daily, the chances of being infected outside and bringing it in is high.
Yeah.
Okay. Secondly, there were cases whereby the infection was brought in by new residents, whereby now we made it mandatory. All new residents coming in must have COVID-19 test conducted first.
So like back to this pandemic as well, do you see a high number of seniors into this nursing home, or do you see them prefer to recuperate or recover at home or at medical centers?
The initial part of the MCO intake dropped because some homes were afraid to bring in allow new intakes. The initial guidelines by JKM was to discourage new intakes, and since we do not allow visitors, so some cannot even see what the environment of the home was, so they do not want to send their parents, and since more people were working at home, there was not a necessity to send their parents to a care center to take care when they can take care of them at home themselves.
Yeah.
So there was a reduction. But as time goes on, people start working, they start going to work, when schools start opening and closing and that kind of stuff. Yes, there was a increase again of people coming to the centers, especially those who have stroke, those who have other illnesses. So there is a sudden rise again.
Then maybe the next question that I have is the drop. Do you think is also because recent unemployment, so people cannot afford even a nursing home right now?
True. That was one of the reasons also. But initially, that wasn't the actual reason. The actual reason was no visitors. I'm working at home. I can take care of myself. Because the unemployment thing all started almost the ending of year 2020. Most of the employment companies closing down, hotels closing down for good, were all in the later part of 2020, not the initial part. The later part, yes, it may have forced some to forego sending to a nursing home, but it won't affect if they are sending to the charitable homes. Charitable homes won't be affected. I mean, it won't cost me much of a make a much of difference because I'm not paying for the charitable home. I'm just sending them there to be taken care of because I can't afford.
Yeah. Okay. Okay, Delren, maybe the last question is more on the vaccination. So I would like to get your thoughts on that priority, right? So the first one is the frontliners, and then the next one are the seniors. So what are your thoughts?
We are asking the government to treat care centers as frontliners, under the first phase, because during the initial MCO, there was confusion whether care centers nationwide were considered essential workers. Later, it was clarified by the Welfare Ministry that care centers are part of the essential worker because they are caring for residents. So on that basis, you should put us on the phase 1, frontliners to be vaccinated. But if you can't put us under phase 1, then you want to put us under senior citizens phase 2, then put us under the priority phase 2 because you have 30,000 residents on the spot there who require vaccination because they are being taken care in group community. So it's higher risk than those individuals staying at home, elderly staying at home. So we are asking to be placed under phase 2, and KKM has agreed to put us under phase 2. But the response from our care centers has not been as good, especially from unlicensed home. The reason why a lot of these unlicensed homes are afraid to come forward is because they are afraid that by coming forward, they reveal their information to the health and ministry. Subsequently, someone may come and ask them to close down. Subsequently, someone may tell them you're unlicensed, you're running illegally. So they are afraid to come forward. Despite now, I have assurance from Dr. Nora Liza from KKM, the Family Unit Department, assuring us that they won't take action. Yet there is still that fear.
Of course. Because there is no guarantee, and I think most of the time, if it's just a verbal agreement, it's quite hard to. Okay.
And it has happened. One case was in Ipoh. Initially, the government did a very good job by testing all the residents in all the old folks home in the country for COVID-19. Free tests conducted. But when they came with the police, they came with the welfare department, they came with everyone. They went to all the homes. And some of the councillors threatened that after all this COVID thing is over, we will come for you. So when you say that, you are scaring people away. That's one. Second case was whereby in KL, Klang Valley, 16 February, the care center submitted the list to be vaccinated. 18 February, they received a warning letter saying that you are pusat jaga yang tidak berdaftar.
Oh dear.
2 days later. But the submission was to Health Ministry, but the letter came from Welfare Ministry. On 21st February, Welfare Ministry stated again another letter saying that we were informed by Health Ministry that you are unlicensed. We would like to meet up with you to further have discussion on how to get your license
Oh dear.
So based on that second letter, we are aware that the health ministry staff or the one who informed the welfare ministry. Initially, those two were a separate issue, but that issue has been resolved. AGECOPE went in to help the center because it's our member. Actually, the lady was in the process of registering and everything, but when it comes to red tape, there's a delay and you go and report. So you can create a fear again. So now if you report once, are you going to report again?
Wow. So it's actually quite tough when the different departments are just not talking to one another. And then for the operators themselves, there's just so many red tapes anyway. Okay. Maybe one final one is that maybe for the operators out there, or people who want to open a care center near their place, is there a way that they can contact you?
Yeah, can. They can contact us through our email, myagecope@gmail.com,
Okay.
and see what's their problem of licensing or what the steps they want to get to do or should they perform to get their licenses.
Okay, sure. Okay. Thank you so much, Darren, for your time. I think that is all that we have for today. So it's good to know that we've got an association out there that's just looking out for operators.
Yes, thank you.
Okay. Thank you.